In section 3, we're going to discuss the nursing objectives and the impact that cellulitis has on the family. Ethical issues that are identified with cellulitis. There are no real ethical issues that are identified with the diagnosis of cellulitis. If there is a constant reoccurrence and a decline in any patient with a chronic illness, or any patient with a disease, ethical issues can be identified and require intervention. For instance, if the patient has peripheral vascular disease or diabetes and has recurrent episodes of cellulitis, this can require intervention. It can require that the patient maybe be evaluated to make sure that they're receiving the appropriate level of care. Effects on the family. Cellulitis often occurs as more of an acute illness that's secondary to trauma or infection or some other underlying disorder. Family support is usually required more for these chronic illnesses. Cellulitis resolves easily with treatment of antibiotics and wound care. No long-term effects occur if cellulitis is treated promptly and it is curable. In this section, we're going to discuss the nursing interventions and the plan of care with the disease of cellulitis. The first nursing diagnosis is risk for impaired skin integrity related to inflammation in the tissues. The second is risk for ineffective tissue perfusion related to impaired arterial circulation as evidenced by pitting edema in the lower extremities. In lower extremities, when a patient has cellulitis, the edema can actually cause the tissues not to be perfused due to the increasing amount of edema. It can act as a tourniquet. It can decrease the arterial blood flow, and it can also decrease venous return. Risk for infection related to a current infection in the tissues, fever and chills. When patients have an existing infection or open wounds, they're also at risk for further infection. Acute pain related to irritation of the skin, impaired skin integrity, or ischemic tissue as evidenced by complaints of pain in the feet and lower extremities. Most patients that have cellulitis due to an underlying chronic illness already have neuropathy, such as with diabetes and peripheral vascular disease. So they're already in a large amount of chronic pain, but they can also experience an acute pain due to the increased amount of edema. High risk for falls related to acute pain and impaired sensation in lower extremities as evidenced by swelling and pain in legs and feet. This occurs more with the elderly population, patients that already have decreased sensation, even patients that don't have an underlying chronic illness that have decreased mobility due to swelling can have a higher risk for falls with cellulitis. In this section, we'll talk about nursing interventions that a nurse can implement with cellulitis. Risk for impaired skin integrity. You're going to keep the skin clean and dry and prevent friction and shearing injuries. Patients that have edema in an extremity or anywhere are at higher risk for friction and shearing injuries. The skin tears a lot easier. You're going to keep any open areas covered and dressed. This is for existing wounds and any subsequent wounds that develop with cellulitis. You're going to change positions frequently to prevent skin breakdown. When a patient has edema, they're at higher risk for pressure ulcers. Monitor for increase in redness and edema, as well as blistering, increased drainage, and changes in skin condition. This could be marking if a patient has cellulitis in a lower extremity. You're going to want to mark the area to make sure the redness isn't spreading, and that the swelling and edema are not becoming worse. Risk for altered tissue perfusion. In an acute care facility, you're going to want to monitor their pedal, their posterior tibial, and their popliteal pulses every 4 hours if it's in a lower extremity. You're going to make sure that the tissue is being perfused by checking the capillary refill that's distal. If it's in an arm, if the arm is swollen from cellulitis, you want to check the fingers to make sure that the fingers are being perfused. If it's in a leg, you're going to check the toes, the capillary refill, to make sure that the tissues are being perfused. This goes with all the nursing diagnosis. You're going to monitor the areas for increase in redness and swelling. For patients that have chronic illnesses, you may want to, if they have cellulitis in the lower extremity, you may want to measure their calf circumference to make sure that the edema isn't becoming worse. This is going to tell you if the swelling is getting worse. The more swelling there is, the decreased amount of tissue perfusion the patient has. You're going to want to monitor the areas for changes in skin, like discoloration and darkening of the tissue. You don't actually want it to get to this point. You want to prevent the cyanosis and tissue death. You want to promote tissue healing, so you want to decrease the amount of edema that are in the legs by elevating the lower extremities to help relieve that edema and promote the venous return. This is a picture of cellulitis in bilateral lower extremities. You're going to want to monitor that edema, like I said, watch the blistering and redness, and check the pulses frequently to make sure that the patient's tissues are being perfused. Risk for infection. You're going to monitor a patient's temperature every 4 hours. You're going to report to the physician any increase in fever, chills, worsening of redness. If you've marked an area in a lower extremity and it's red, and the next day the redness is extending up to the knee, you're going to notify the physician that's actually becoming worse. If a physician orders CBC, you're going to monitor the white blood cell count with the MD ordered labs and make sure that you report if it's becoming more elevated. In the elderly population, a sign of septicemia can be a change in mental status. If you are in an acute care facility and the patient suffers a change in mental status and becomes more lethargic, you're going to need to report that. That can be a sign that the infection is actually becoming worse. If you work in a physician's office and the family reports that the patient has been lethargic and that they just haven't been doing what they usually do or acting normal, that's something that you need to report to the physician. That can actually be indicative of a worsening of infection or infection that may require hospitalization. Acute pain related to edema and wounds in the lower extremities. You're going to encourage the patient to elevate the lower extremities to help relieve some of that edema. That's a nursing intervention that you can implement to help promote venous return and help relieve some of that edema so that the patient actually gets relief from it. If the physician orders pain medication, you're going to administer the analgesics with a physician's order. If the patient's at home, if you're in a community setting and the patient is at home, you're going to instruct them on administering those pain medications and taking it to support themselves through this episode of cellulitis. In an acute care facility, you're going to want to monitor their pain level and for nonverbal cues of pain every 4 hours. If you administer an analgesic with a physician's order, you need to make sure that they're achieving an adequate level of pain control when you administer it. High risk for falls related to decreased sensation and pain in lower extremities. This occurs more often with the elderly population that already have those underlying chronic illnesses. With diabetes and peripheral vascular disease, I said prior that neuropathy can actually already lead them to have decreased sensation, and they're already at high risk for falls. When you add a swollen, painful extremity, that decreases their mobility. Even patients who don't have neuropathy, if their legs are swollen and red and tender, they may not feel themselves walking like a normal person would or like they would at baseline. For the elderly population, you may want to obtain an assistive device with a physician's order, such as a walker, a cane, to kind of help them through and help them be able to get through their ADLs and walk more safely. For patients in an inpatient facility, you're going to encourage them to use the call light. You're going to ask them to call for assistance with transfers and ambulation and tell them to not get up without help. You're going to educate patients and family members that they are at increased risk for falls and that they need to prevent further trauma by wearing non-skid protective footwear and calling for assistance. Key points to remember throughout our presentation for cellulitis. Cellulitis is an inflammation and infection in subcutaneous and connective tissues. That's the definition of cellulitis. Risk factors for cellulitis include trauma and wounds. This can be a trauma from an injury to the leg getting out of bed. It can be a surgical wound. Underlying disease like diabetes or peripheral vascular disease. Most of these patients already have open wounds. Some of them may not, but they're at increased risk for cellulitis. Immunosuppression, patients who are on immunosuppressant therapy, patients who have chemo, ones who have IV lines, ones who've been in the hospital may have cellulitis in an upper extremity and a lower extremity. They're at increased risk due to that. Symptoms include redness, swelling and edema, warmth in the area, blisters, and fever and chills. Like I said prior, cellulitis is most of the time unilateral. It occurs on one side, but in patients with underlying chronic illnesses, it can occur in both lower extremities. Cellulitis is often treatable it has an excellent prognosis for recovery. It's more a secondary illness that occurs from trauma or another disease like diabetes or PVD. The treatment for cellulitis is antibiotics and supportive therapy for existing or subsequent wounds that develop. A lot of times with the edema, blisters develop and you may need to implement wound care. The patient may benefit from a wound care consult from a WOCN certified wound care specialist if they have chronic wounds and have recurrent cellulitis. Cellulitis usually resolves, but there can be a high incidence of recurrence with patients with chronic underlying diseases, like I said, PVD, diabetes. Patients with chronic wounds that are not resolving may have recurrent cellulitis. Patients are at high risk for alteration in skin, and they require frequent assessment of their skin integrity and monitoring until this resolves. They may require wound care, like I said, to keep open wounds clean and dry and covered due to risk for further infection. You don't want any further infection developing from open wounds. Patients with cellulitis are at risk for altered tissue perfusion. They need monitoring instruction on signs of tissue necrosis for patients who are maybe at home and are receiving wound care at home. Patients that are in an inpatient acute care facility may need monitoring of their pulses. That's going to be for more severe cases of cellulitis that have severe edema. Symptoms of altered tissue perfusion include change in the extremity color, diminished pulses, delayed capillary refill, and darkening of the tissue. That's actual cyanosis occurring. Patients may be at high risk for falls due to pain. They may already have chronic pain and decreased sensation from neuropathy from an underlying disease. You're going to instruct the patient and family on fall precautions. This is important on patients with cellulitis of the lower extremities. And this concludes our presentation on cellulitis.